Hello, Mayor Reinersman here. I want to give you a quick update on our current COVID situation. I started my morning on a Zoom meeting with the governor, followed by a conference call with county government, St. E's CEO Garen Colvin, and Northern Kentucky Health District. This afternoon was with Kentucky Emergency Management and the Kentucky Department of Public Health. I'd like to share some of the information that I've received. The bottom line is all of these folks are very concerned with our current conditions. Starting with good news, as we've all heard, we are very close to a vaccine. While we are within weeks of them being deployed, most likely, it's going to be months before it reaches the general public. Until then, we need to continue to mask up, wash hands, and social distance to stop the spread. As you probably know, vaccines are going to start with residents and workers in long-term care facilities. This makes sense since 66% of the deaths in the state can be attributed to these facilities. The second priority will be the highest risk healthcare workers, such as those working in the ER and COVID units, and then first responders. The next group after that will probably be folks at high risk due to age or health conditions. Educators are also likely to be toward the top of the list because vaccinating teachers can significantly increase the capacity for in-person instruction that we're all hoping for. Now for the bad news. Just today, the White House Coronavirus Task Force said that we are in a very dangerous place and that the COVID risk to all Americans is at a historic high. By comparison, during June, we were averaging about 25,000 new cases a day as compared to more than 180,000 right now. Now, a lot will say it's because we're testing more, and I'm sure there's some truth to that. However, they also reported that hospitalizations were under 30,000 at that time and are now over 90,000, and that fatalities have more than doubled. Locally, St. E's has been reporting anywhere from 20 to 45 hospitalized patients during our monthly updates over the last several months. They are currently at 176. I don't tell you this to sow fear. I tell you all of this because with a little bit of sacrifice in the near term, we can really stem the current tide. More importantly, we have to stem the tide to keep from overwhelming our healthcare workers, healthcare systems, and seeing a continued increase in deaths and serious illness. The current restrictions put in place by the governor's executive orders run through December 13th. This was a very intentional time frame designed to get us through an infection cycle. If we can strictly adhere to face covering, hand washing, social distancing, and particularly avoiding large gatherings during this time, we can really make a difference. I know there's a lot of mixed feelings on this, and I'm begging you to please help us get through the next 10 days. The fact is the science overwhelmingly supports that face coverings work. Logic also supports it. This disease is primarily spread through airborne transmission, or basically droplets of spittle that are exhaled. While a basic cloth mask isn't going to catch everything, it will catch a lot, therefore reducing the risk of spread by a lot. Secondary transmission is from surfaces. That's why hand washing and not touching your face are also important. Obviously, if people aren't gathered together in large groups, particularly indoors, there's far less chance of airborne or surface transmission. I realize this is tough on all of us, but let's remember some of those that it's toughest on. Aside from those getting sick and dying, our first responders, healthcare workers, restaurant operators, and restaurant employees are all disproportionately suffering. By deciding to wear a mask, avoid gatherings, and so on, you can make a real difference to these folks. Finally, we're heading into our Christmas Walk weekend, which is traditionally a huge celebration and gathering in our city. This year, we've eliminated most of it. Along with our partners in the city and the business community, I've made the decision to continue the Santa 5K and lighted Christmas parade this Saturday. This decision became far more challenging in these last couple of weeks as things have ramped up. During the summer, however, I watched as we all got together for the modified Independence Day parade and did so in a safe, socially distanced manner. I'm confident that we can do that again and still retain some of the celebration of the season. I ask that if you do choose to attend, you do make an over-the-top effort to maintain safe distancing and even put on a mask outdoors. Heck, it'll probably keep you a little warmer. I appreciate your time, and I look forward to a time when we can all get together again and have some sort of normalcy. Our efforts now will bring us to that time sooner and at a lesser price. Thank you.